My name is Heun. I'm a consultant psychiatrist, and I'm reporting about the essence of different psychiatric papers we published in Global Psychiatry Archives. This is a paper from Ahmad, and he looked at the quality of online media reporting of suicidal behavior in Iran during the COVID-19 pandemic, and checked it with the WHO guidelines. And the interesting part is that the guidelines haven't been followed. I'll tell you what is it and what shouldn't they follow. There were a total of 125 Farsi news report from 30 newspapers in a specific time during COVID, and they reported about the suicides in different ways. These are the newspapers, and when they were published, name of the paper, which I can't translate anyway, 125 articles. And there are some issues which are potentially harmful, which is when the name is stated, when the occupation is mentioned, and when the method is stated, details of the methods. This is sometimes causing copycat events. When they talked about suicide notes, everything is personal and which might interest people to repeat that. The headlines, if it's in the headlines, the methods in the headlines, and talking about real life events or dramatizing things, that's what the WHO wouldn't want. Effects on the beliefs and interviews of the belief, that's something which people wouldn't want if you just talk about suicide without having the interest of people who might be wanting to see what happens when they kill themselves. They also had some photos, which usually are not recommended to prevent suicide. What's possibly helpful if people learn about warning signs, mental illness, drug abuse, and their relevance. They're also positive would be if there's an expert opinion, research finding, specific statistics and explanation, refer to preventive program, education, information. None of the latter was given. So usually when you have a good report, it should be neutral, nothing very, very personal or sensational. It should be informative, educational, and the reference to prevention and educational information should be provided. So there's lots to be done. This hasn't been done properly, and I think the paper is important to indicate the relevance that we should have better information about suicide from journals and from newspapers and from the society. If you like this type of information, please subscribe to our channel. If you like as well, please can click like. Thanks for your interest and have a nice day. Thank you.